Hello, my name is Lily and I'm a second year student nurse from Newcastle, and today I'm going to be talking to you about the importance of safe staffing levels within the NHS. It's well documented that safe levels of nursing staff within the NHS is associated with improved outcomes for both patients and staff. For example, lower mortality rates, higher patient satisfaction, shorter hospital stays and increased staff morale. So why are 8 and 10 shifts currently understaffed? The Royal College of Nurses stated that currently 8 and 10, which is 83% of nursing staff who responded to their survey, said there weren't enough nursing staff to meet all patients' needs safely and effectively during their last shift. This is extremely worrying as understaffed wards can lead to several negative consequences, such as a delay in administering critical medications, documentation of vital signs being missed, a delay in patient checks such as personal, pain management, placement of water and comfort. Inadequate staffing levels also have a negative effect on staff. The Royal College of Nurses revealed that 59% of staff said that they felt upset or sad that they couldn't provide the level of care that they wanted on their last shift. As nurses, we really want to give the best possible person-centred care. It's the reason we all decided to be nurses, to care for those in need. However, staffing issues is standing in the way of this want. Next, I'm just going to briefly talk through some of the history behind NHS staffing levels. Research and concerns regarding safe staffing levels within the NHS have been discussed for many years. However, the importance of safe staffing levels were brought to the forefront upon the Mid Staffordshire Hospital public inquiry in 2013. This public inquiry concluded that a structure and culture of decision making was deeply flawed and resulted in serious failures to occur. The government reviewed this inquiry and subsequently agreed with its findings and suggested a fundamental review of parts of NHS England. The inquiry also highlighted that nurse staffing levels had been neglected, with the trust policy focused more on controlling finances and subsequently disregarding patient safety. Following this inquiry, national policies and guidelines were produced, leading to fundamental changes within the NHS, ensuring that safe staffing levels were there to protect patient safety. Alongside the structural and cultural problems of Mid Staffordshire, the implementation of austerity measures by the Conservative government are thought to play a part in its failings. Following the 2008 global financial crisis, the government imposed national austerity measures where the NHS were expected to make savings of up to 20 billion. At the time, concerns were raised about potential negative effects on staffing, but no policy regarding safe staffing levels was introduced. A problem that leads to a shortfall in staff is staff retention and attracting new nurses. The latest figures from the Nursing and Midwifery Council have shown that the number of new nurses coming from the EU to work in the UK has dropped by 87%. As the NHS relies quite heavily on workers from outside the UK to make up for its own shortfall in staff, this is really worrying and could possibly be one of the reasons why there is such a staffing crisis in the UK currently. Alongside losing staff from the European Union, staff retention also has had a big part to play in staffing levels. Research suggests that NHS staff are leaving due to the deterioration of their professional environment. This chronic shortage of staff means that conditions for those remaining have worsened, thus prompting ever more staff to leave. While the number of NHS nurses in June 2021 were over 300,000, this figure has significantly increased since the birth of the NHS in 1948. However, this figure does not keep up with modern healthcare requirements, such as an increased population and increasing ageing. I'm just going to briefly talk through some recent examples of the staffing crisis within the past few years, just to paint a picture of what the reality is in nursing up and down the UK. In January 2021, the Royal College of Nurses released a statement expressing that they were seriously concerned about staff wellbeing and patient safety in intensive care units, as they were running considerably beyond their capacity. Usual nurse to patient ratios in intensive care are 1-to-1, whereas nurses were having to work with multiple patients to meet demands. This creates pressure on nursing staff and becomes harder to provide safe and effective care to patients. However, this shortage isn't simply limited to intensive care. The same shortage has been seen across an array of wards up and down the country. For example, Glasgow's Queen Elizabeth Hospital saw that there was one registered nurse in the whole ward, and this was across a number of different wards such as gastroenterology, rheumatology and diabetic ward. Results from a survey from the Royal College of Nurses showed that only a quarter of shifts have the planned number of registered nurses. This is shocking. This can mean that essential care is left undone, patients wait longer for treatment and vital services remain undelivered. When a ward or community setting is short-staffed, those delivering the care have no option but to carry on or to leave their profession altogether. This ongoing pressure is unsustainable. So what exactly are safe staffing levels? Though NICE doesn't state an exact golden number of qualified nurses within their guidelines, it does highlight a number of red flags for nurses to watch out for, such as unplanned omission of medications. And this can be really crucial as some medications such as Parkinson's meds are really time critical and can be extremely detrimental to the patient if missed or delayed. Another problem that can come up is patients having to wait more than 30 minutes for pain relief. This is really important because as nurses we really want to help people and manage their symptoms. And pain management is really important as a nurse. It can be quite a straightforward task to relieve someone's pain by giving them pain medication. So it can be quite frustrating as a nurse to not be able to achieve these things. Vital observations is another red flag. This is a really important red flag as vital observations give us an insight into a person's clinical condition and allow us to escalate care when necessary and appropriate. Another red flag is a delay in patient checks. This is really important as nurses we need to uphold people's dignity. If patients go left unchecked, they may become uncomfortable and pressure sores may emerge. I'd just like to take a bit of time to talk about my own personal experience as a student nurse on understaffed wards. Sometimes you feel like you're missing out on key learning opportunities, and sometimes can feel like nurses simply don't have time to show and explain things in the detail they'd like. I've also spent a lot of time levelling patients, ensuring that they're safe and don't fall. Although I accept this is part of the job and very important to keep patients safe, student nurses are meant to be supernumerary and not counted in the numbers, and it can feel a little bit frustrating at times being counted in the numbers to be used on Baywatch. You feel like you can't give the kind of care you'd like to give due to time restraints and shortage of staff. There's also been opportunities where I've missed breaks, which is really detrimental. As nurses and healthcare professionals will work long shifts, it's really important to get that break just to rest and recuperate, even if it's just for 30 minutes. Although this problem of safe staffing levels is really complex, the Royal College of Nursing is campaigning for change. It wants the Secretary of State and Social Care to undertake and publish a detailed assessment and analysis of future workforce demand and supply requirements for all health and services across England. Royal College of Nurses also focuses on the expansion of nursing students and full financial support for them, including scrapping self-funded tuition fees and grants that reflect the real cost of living. A lack of financial support for students on nursing degrees has resulted in a really worrying decline of number of people applying and coming forward wanting to be a nurse in England. The Royal College of Nurses also suggests that in order to retain staff and attract more people to nursing, we must be given fair pay and fair working conditions. Nurses are the heart of our health and social care services. We work across boards and in the community, and we care for those in need and help keep people safe to the best of our abilities. But in simple truth, there aren't enough nursing staff to provide the kind of care that we want to give and what patients deserve. If nurses were paid fairly and working conditions were kinder, we wouldn't have such a crisis and shortfall in staff. The shortage in recruiting new nurses could be solved by abolishing tuition fees and reintroducing grants and bursaries that truly reflect the current cost of living. Nurses work extremely hard to keep people safe and provide patient-centred care. Nurses deserve higher pay, and this also would help attract more nursing staff. I hope you enjoyed my video and it showed a bit of an insight into what it's like being a nurse in the UK at the moment. Thanks for watching.